H is for HER2. Every breast cancer will have a HER2 score, but what does it actually mean and why does it matter so much for treatment? So HER2 is a receptor. It's a protein that sits on the surface of your cells. Think of receptors like little satellite dishes designed to pick up messengers or growth signals from outside the cells and pass them inside all the way to the nucleus where your DNA lives. But HER2 is a bit different. It doesn't have its own messenger that plugs in. Instead, it acts like a booster switch. It pairs up with other receptors, and when they're switched on by the messengers, the HER2 receptor boosts the signal, telling the cell to divide and grow. Now, healthy breast cells only have a small number of HER2 receptors. They are HER2 negative. But 1 in 5 breast cancers have a mutation that means they make lots of them, and these are called HER2 positive. Those growth signals are boosted again and again and again, and the cancer keeps dividing out of control. HER2 positive cancers are treated with drugs that attach to the HER2 receptor and stop it working, like Herceptin, Perjeta, and Kadcyla. And to find out if your cancer is HER2 positive or negative, we count the number of HER2 receptors on the cells and give it a score. 0 or +1 means HER2 negative. There aren't enough HER2 receptors for the anti-HER2 drugs to work. A score of 2+ means it's borderline. Here we need an extra test called FISH to see if the cancer really is HER2 positive. And 3 is HER2 positive. That means there are lots of receptors for drugs like Herceptin to target. You might also hear about HER2 low. That means the score is 1 or 2, but the FISH test is negative. For years, we just call these cancers HER2 negative, but now new treatments are emerging, like Enhertu, that may help people with HER2 low cancers if it comes back in the future. And adding these treatments to chemotherapy has dramatically improved survival with HER2 positive breast cancer. If you want to find out more about HER2 positive breast cancer, check out the linked video in the captions. I'm Dr. Liz, and thanks for watching.